We are honored to be joined by Andrea McChristian, who is Law and Policy Director at the New Jersey Institute for Social Justice. Good to see you.
Good to see you too, Steve. Thanks so much for having me. You
got it. By the way, check out our website, which you'll see up there for past interviews we've done with the great Ryan Haygood, who leads the organization that Andrea works with. Part of our series, Confronting Racism, see the graphic up there as well. The 2021-2022 action agenda for racial disparities in the state of New Jersey, particularly for minority youth. Andrea, what is it and why does it matter now more than ever?
Sure. So I think, Steve, that's such an important question in this time where both nationally, we're seeing so much racial unrest and injustice highlighted by the recent insurrection at the Capitol. But here in New Jersey, we're also seeing that this is a critical election year with every single seat in the New Jersey legislature up, as well as the governor's seat. And so while many have rallied around the proclamation that Black Lives Matter, at the Institute, we really wanted to put actions behind those words by creating our 2021 through 2022 action agenda to make Black lives really matter in New Jersey. Because we want to make sure that the people who want our vote this key election year are responsive to issues that are of the utmost importance to communities of color here in the state.
Andrew, let's identify the top two or three and we'll continue to talk. Go ahead. Those issues are?
Sure. So we think closing the racial wealth gap is an issue of the utmost importance. Here in New Jersey, we have one of the starkest racial wealth gaps in the country, with a white family making $352,000 median net worth, highest in the country, but only $6,100 for Black families. So what are we looking at to close that racial wealth gap? We're looking at baby bombs. That's something that Governor Murphy has prioritized in the past that we're working with legislators to advance now. We're looking at guaranteed income programs. Here in Newark, they had a guaranteed income task force, and other cities throughout the state are also starting up their own pilots. We're looking at expanding home ownership opportunities, particularly for Black communities, since we know there is that divide within home ownership between Black and brown communities and white communities in the Garden State. And we're also looking, following the national level as well, canceling student loan debt. We know that's one of the major drivers of the racial wealth gap, in addition to home ownership. And we want to make sure that people who are already having their wallets stretched during the COVID pandemic don't have to worry about student loan debt as well.
Since you mentioned the COVID pandemic, talk about disparities, racially based disparities as it relates to the delivery of healthcare, A, and B, this COVID pandemic that we are facing, but the African-American community facing much more deeply than others.
Sure, Steve. And so, kind of as I highlighted, New Jersey is home to some of the starkest racial disparities along a bunch of different issue areas. We have the highest Black to white infant mortality rate in the nation. We have the highest Black to white youth incarceration and adult incarceration disparity rates in the country. Starkest racial wealth gap. Use of force is disproportionate against Black people. Hospitalizations, everything kind of comes to a head in the Garden State. And so there were already huge racial inequities pre-existing before the COVID-19 pandemic, which has just exacerbated them. Because as we know, Black and brown communities tend to be essential frontline workers disproportionately, tend to live in more crowded housing, are subject to the digital divide at more extensive levels than their white counterparts, and also don't have access to the same adequate health care. There was an article that came out just today in the New York Times that was talking about here in Newark, where it's about, which is over 80% Black or Latino, right. 1 in 342 residents has died from virus-related complications. And so we're seeing the COVID-19 pandemic feeding upon the racial disparities that already existed to disproportionately harm these communities even further. And so, oh, go ahead.
Well, let me just try to follow up on that. Mm-hmm. I've mentioned the Tuskegee Experiment many times, okay? And again, I keep referring people to it, but tell me if my interpretation is correct. During the 1930s, there were a series of experiments that the government sponsored where African-American men were, it was an experiment around syphilis. They were given syphilis. They were guinea pigs. And that, in many ways, has created much, not alone, but much of the distrust of the healthcare system in this country. Is that an accurate interpretation of it?
Sure. I think, Steve, to your point, distrust of the medical community because of Tuskegee and a number of other just generational impacts has led to distrust being one of the factors in why kind of the healthcare distribution is the way it is within Black and Brown communities. But in addition to that, something that we do need is data. Data really serves as the foundation of kind of everything that we need to develop systems, policies, practices to, one, break down that distrust and distribute as effectively as possible. And here in New Jersey, we have incomplete data. The data that we have shows that, yes, half of those vaccinated have been white and very few have been Black or Latino, but that's incomplete data. Something that we've also pushed the state for in partnership with coalition members is we were able to successfully advocate for New Jersey releasing data publicly on COVID-19 deaths, hospitalizations, cases by race and ethnicity. But the state has failed to release that information at the local level, at the zip code level, which is exactly where we need it.
But sorry for interrupting, Andrew. As we tape this program, the 2nd of February, it's not released. Is there a sense that it's going to be released, say, in the next month, 90 days, whatever, next 30 to 60, 90 days? Or is it just not going to be known?
We've gotten no indication. We've asked, we've had advocacy tools. We've reached out to the state to say, when are we getting this data? And we've been met with a number of different explanations, but have not been given the data that we need that is required by the law.
Let me ask you this, in the time we have left, about a minute left. In spite of everything that you just said, which matters a lot, do you encourage people in the African-American community to get the vaccine?
Sure, we encourage people to do the research they need to feel comfortable with taking the vaccine if that's what they choose to do. But we think that what is critical is making sure that everyone has the information they need, everyone understands where they can get the vaccine, and to know that there is at least an attempt by the state to break down that mistrust, which has been built over so many different generations.
Yeah. Real quick, I shouldn't do this because I have to go to a throat. January 6th, the insurrection at the Capitol. Do you believe a significant portion of that part of it was racially motivated?
It was white supremacy personified, where there was a challenge to a legitimate election, legitimate results. And instead of dealing with it in a fair democratic way that this country would welcome, there was an insurrection at the Capitol with white supremacy as the foundation.
And the other part of that foundation is that many of those folks believe that the disproportionate number of those votes they said that didn't count or were stolen or cheated are people who are Black. That's just a fact. Andrew, I want to thank you so much for joining us. We appreciate it. Our best to Ryan and the entire team at the New Jersey Institute for Social Justice. You honor us by being with us. Thank you, Andrea.
Thank you so much, Steve.
You got it. I'm Steve Adubato. Stay with us. We'll be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, University Hospital, New Jersey Sharing Network, the Healthcare Foundation of New Jersey, the Robert Wood Johnson Foundation, NJM Insurance Group, the North Ward Center, MD Advantage Insurance Company, and by Suez North America. Promotional support provided by Meadowlands Chamber and by New Jersey Monthly.
I'm Miles, and this is what I work for. To be my best for them and for me, in body and in mind. I need a health insurer that helps me get the care I need for both. That has mental health professionals that I can talk to when I need to. Because when I feel strong and secure, so do they. This is my life. And this is how Horizon Blue Cross Blue Shield of New Jersey works for me.